So students, in today's lecture we are going to have discussion on renal drug excretion. So before going into the detail of our topic, you must have a general concept of pharmacokinetics. Then you must also know that what is renal physiology. So in this lecture we will first discuss pharmacokinetics, then we will have discussion on renal physiology, and then we will correlate this renal physiology to pharmacology. Now let's move towards pharmacokinetics. Basically, the word pharmacokinetics is a combination of two words, pharmaco and kinetics. The word pharmaco is actually derived from a Greek word that is pharmakon, and the word pharmakon means drug, while kinetics is an English word which means moving. So now what is pharmacokinetics? Pharmacokinetics is the study that what the body does to the drug when it is moving inside your body. What the body does to the drug when it is moving from one organ to another organ. So what happens when the drug is administered? How they move inside your body? Do they indefinitely stay in your body or are they eventually excreted? So students, these are the questions which are answered by 4 phases of pharmacokinetics, and these 4 phases of pharmacokinetics are abbreviated as A, D, M and E. Now here A is actually absorption, D is distribution, M is metabolism and E is excretion or elimination. So what happens when the drug is administered? How they move inside your body? What happens to the drug? So students, basically all these discussions are part of pharmacokinetics. Absorption is when the drug is inside your bloodstream, and the level of absorption affects the speed and quantity of the drug at the site of action, which is termed as bioavailability. And more precisely, bioavailability is actually the fraction of active form of the drug that is available at the site of action in its unaltered form. So bioavailability is basically referring to the drug that is in your systemic circulation in an unaltered form. Now after absorption, the drug is distributed from the plasma into the targeted organ. And this distribution of the drug basically depends upon 2 main factors. The first factor is the molecular weight of the drug, and the second factor is the binding of the drug to the plasma proteins. If your drug is bounded to the plasma proteins, it means it has lower volume of distribution. After distribution, your drug is metabolized. Now what is metabolism? Metabolism is actually the process in which the drug is broken down into active or inactive metabolites, and this mainly occurs by means of enzymes located in the liver. So after metabolism, we have next step, that is excretion. But before going into excretion, you must know that some drugs are metabolized to stop them from working, while others are metabolized or modified to convert them to more active form. And these active forms of drugs are actually representing that previously you were having a prodrug and after metabolism you have the active drug. Now what is excretion? Some drugs are directly eliminated by the body with the help of the kidneys in the urine. So this happens when your drugs are in polar form. So basically the concept of metabolism was to convert your drug into more polar forms so that they can be easily eliminated or excreted from the kidneys. Here you must have concept of elimination and excretion. Basically, elimination is a broader term that is combination of 2 components, that is biotransformation and excretion. Here biotransformation is actually referring to metabolism, whereas excretion is simply the removal of the drug from the body. So here you must remember that kidney is the most important organ of excretion, and the patients with renal dysfunction are unable to excrete the drugs, and thus they can accumulate the drugs and may suffer from the adverse drug reactions. So students, you must know that these kidneys are very important if you want to eliminate or excrete the drugs from the body. Otherwise, you may suffer from adverse effects or side effects of the drug. Now, these two words, that are adverse effects and side effects, are different from one another. Side effects are actually the documented effects of the drug, while the adverse effects are the unpredicted effects of the drugs.